Welcome to day 9 of ACULIFT Cosmetic Acupuncture. Today we're going to talk about sagging facial muscles, eye bags and dark circles, age spots and skin discoloration, acne, eczema or dermatitis, and rosacea. As we age, our skin loses its firmness and elasticity. This is evident in our physique as well as facially. What do we do about it? Well, if we are keen and able to stick at it, we exercise and go to the gym regularly to try to tighten up those sagging muscles. We need to do exactly the same for the face. This can be achieved with facial exercises, or we can try ACULIFT. This treatment gives the muscles of the face a workout and also simultaneously stimulates the chi to help with circulation. The resulting production of collagen helps to bring back some elasticity into the face. Many of the facial points in the protocol have been selected in part for their relation to the underlying muscles. If you have established that facial sagging is the main focus of the treatment, you may like to add in this propeller technique on the cheek. Another extra point chosen for its capacity to tighten the cheek area is located 1 to 2 tsun above stomach 5, then 1 tsun back towards the ear and into the cheek muscle. Muscle is masseter. Needle size 15 mm by 0.20 mm, gauge 36. In addition to the cheek point used in the protocol, choose an ashi point on the cheek. An ashi point is an unnamed acupuncture point chosen for its sensitivity and location. Palpate to find an area where you can feel the band of muscle running across the cheekbone. Insert the needle into the point and twirl the needle in a clockwise direction, but with an action similar to winding up a propeller on a rubber band aircraft. What we are attempting to do is to catch the facial muscle with the needle and tighten it with a twirling action. If this technique is administered successfully, you should find a lot of tension on the needle as you do this. Needle this point bilaterally. To remove the needle, it is a case of pulling back on the needle and gently unwinding the needle in anti-clockwise direction. It can then be safely removed. If you have a patient with significant facial sagging, use 2 or 3 of skin tightening points on either side of the face. When we are treating a patient's eyes and the surrounding area, we also need to look at the constitutional points that we might be able to use in order to improve the appearance. Many patients come to us complaining of eye bags and a general puffiness under the eye. According to TCM, all diseases that relate to the eye are closely linked to the liver, as this meridian opens at the eyes. In 5-element acupuncture, the liver is the organ responsible for the smooth flow of blood and qi in the body. If this organ is out of balance, then there is a very good chance your patient will be stuck, perhaps congested, and unable to move freely. This might result in stagnation and consequential dark circles around the eye. In order to release this congestion and have the qi flowing smoothly again, we would look at treating the liver source point, liver 3. This is a point that we are already using in our initial grounding treatment as part of the ACULIFT treatment alongside LI4. We would pay particular attention to these points and tonify them at the end of the treatment. as Li4 will further help to reduce any swelling or edema. The partner organ of the liver is the gallbladder, and both meridians are of the wood element. One of our favorite gallbladder points for anything eye related is gallbladder 41, or the foot above tears. What a perfect name, which sums up exactly what it can do. Already in use as part of the main protocol, this in combination with liver 3 is recommended for anything that involves stagnation of the eye. Stomach 44 is one of the first points that we needle, and it is a great point to help clear stagnation. If it is immediately apparent on your first consultation that this eye condition is of concern to your patient, then we would definitely not omit stomach 44 from your initial grounding treatment. Bluish eye bags can be a sign that the kidney channel is affected and fluid is being retained. Kidney 3 is a shoestring point, and these points of the yin channels are the primary point on each channel for regulating and harmonizing their respective zang, and may therefore be considered as the single most important point of their respective channel. Bladder 1 has to be needled slowly and with extreme caution due to its location, but it can aid with fluid retention around the eye and other eye issues. We already used stomach 2 during the protocol, and this will help to reduce swelling to the lower eye by moving qi and blood to the area. Auricular points that can be added are, of course, the eye and also spleen for its role as transporter of fluids. Surrounding the dragon is a technique that can be used for treating age spots and patches of hyperpigmentation. We absolutely love the description of this treatment. It actually sums up what we are trying to achieve so descriptively. Using 6 mm intradermal needles, insert them so that they point towards the age spots or discoloration. The number of needles will vary depending on the size of the target area, so you will need to use your judgment here. The main priority is to ensure that the area is completely surrounded. These needles can then be left in for the duration of the treatment and removed along with the other facial needles. This technique helps fade age spots or discoloration by encircling the area with needles and thus redirecting the qi underneath the damaged tissue, often caused by sun exposure and ultimately outwards in a bid to regenerate the skin. Acne affects millions of people worldwide and is considered to be the most common cutaneous disorder in the Western world. If someone presents with acne, we would generally begin with a course of 5-element acupuncture treatment. However, there are general points that you could try to improve the condition based on TCM principles. Acne is often attributed to the lung, large intestine channels, and the spleen, stomach channels. We have touched upon the subject of acne in earlier discussions and explored how the point stomach 9 could be utilized to treat overactive sebaceous glands and how the application of pantothenic acid serum could improve acne and open pores. Retinol serum could also be applied to the skin. As it has a drying effect, however, care needs to be taken when using vitamin A. It should not be administered to those taking prescribed acne medication or anyone who is trying to conceive, is already pregnant, or breastfeeding. When the acne is caused by a hormonal imbalance, perhaps exacerbated during the menstrual cycle, the endocrine auricular point can be used to help balance the system. we have established the connection of the lung meridian in connection with the skin. So we would also consider using lung 5, a Hussey point on the arm, and the Hussey point of the large intestine, Li11, for its widely known benefits for skin issues. The spleen governs digestion and transportation, so stagnation in this channel may result in blemishes. Consider using the spleen point on the ear to help the free flow of qi along this meridian. It is also possible to locate points around the infected area using the surrounding the dragon technique. This dry skin condition, also known as dermatitis, is characterized by red, scaly, and itchy skin that can vary in severity from person to person, especially as it comes in many different forms. In many developed countries, over 1/5 of the population are affected by one or more atopic allergic disorders. The skin of an eczema sufferer doesn't produce as much oil or fat as those without the condition. This lack of protection sees channels opening up because of the inability of the skin to retain water. As both a classical 5-element acupuncturist and ACULIFT practitioner, we are often called on to help with eczema on the body, and we have also found that facial eczema can be particularly distressing to patients. The premise behind both traditional and facial acupuncture is that it is holistic. So, we are aiming to balance mind, body, and spirit in order to help settle the problem. We would therefore tend to treat constitutional body points before we begin to target specific areas. We believe that how we look is very much related to how we feel, and eczema can be particularly debilitating due to the accompanying itch, which can be quite painful and lead to the skin splitting and bleeding. We would certainly suggest that a patient visit their doctor or dermatologist, particularly if their condition has yet to be diagnosed. What is very encouraging is that recent studies, such as effect of acupuncture on allergen-induced basophil activation in patients with atopic eczema, a pilot trial, have been examining the successful reduction of itch intensity following treatment with acupuncture. Apart from bladder 6 and bladder 2 on the head and face, and the aggressive energy drain that we can choose to perform at the patient's first treatment, we do not use any other bladder points during the treatment. This is due to the fact that as the meridian runs down the back and the back of the legs, it is not an easy channel to access whilst your patient is having cosmetic acupuncture. However, there are a couple of points that may be worth tonifying at the start of treatment in this case. Bladder 17 on the back and bladder 40, a Hussey point on the back of the leg, are commonly used for itching skin. Family studies say that atopic disorders result from a complex interplay between genetic and environmental factors, and like many conditions, the triggers can vary. So diet may be a factor, or stress may result in a flare-up. Your patients may also find that climate could play a part, or household allergies. Stress seems to be a common trigger for many of our patients, and they find that the acupuncture helps in this regard. There have been many studies carried out that highlight the role acupuncture can play in reducing anxiety and acne. Although small study focusing on a single acupuncture point, Heart 7, found an average 44% reduction in stress. The Shenman auricular point is needled bilaterally every treatment, and this could be used to garner the same effects. The ACULIFT protocol will aid with general inflammation and swelling, as many of the points included are indicated for this. Again, we would suggest LAM5 and LI11 could be tried for their relation to skin conditions. Rosacea is characterized by two clinical components: a vascular change consisting of intermittent or persistent erythema and flushing, and an acneiform eruption with papules, pustules, cysts, and sebaceous hyperplasia. If you are a sufferer or you have treated patients with rosacea in your own practice, you will know how this chronic skin condition can affect self-esteem and confidence. Often, rosacea strikes in middle age as redness on the nose, cheeks, forehead, and chin. Patients will experience different triggers, and the most common seems to be sun exposure, closely followed by emotional stress. As practitioners, we regularly advise on lifestyle factors, so it is worth your patient trying to determine what may be exacerbating the condition. We can help to balance the body, mind, and spirit. And as for other skin conditions, we would focus on our 5-element acupuncture training to help address this issue. That said, we have had good success with rosacea from the ACULIFT protocol alone, as we find that it really activates the chi in the face and helps to clear the skin. Depending on your patient's response to the initial protocol, LAM5 and LI11 could also be added to your treatment plan to see if this boosts the effects. If your patient has already established their triggers, it is important to find out whether they may be related to any of the creams you choose to use during a facial treatment. That is another reason for sourcing cleansers, serums, and post-treatment creams that are beneficial and suitable for sensitive skin. With 4 subtypes of rosacea: erythematotelangiectatic, papulopustular, phymatous, and ocular, it is important to take your usual in-depth consultation and to discuss the realistic expectations about the outcomes of treatment depending upon their particular condition. The beauty of acupuncture is that it accepts that everyone is different and ensures that we maintain the holistic experience that this truly wonderful practice provides.